It is my pleasure to introduce Georgia Eid. I am Cynthia Myers-Morrison and your webinar and YouTube hostess for the Food Addiction Institute. And we're delighted to have Georgia Eid with us today. Dr. Georgia Eid is a Harvard-trained, board-certified psychiatrist specializing in nutrition. She speaks internationally on ketogenic and other dietary strategies for psychiatric conditions, the nutritional differences between plant and animal foods, and nutrition policy. She has 2 decades of clinical experience, including at Harvard University Health Services, where she was the first psychiatrist to offer nutrition-based approaches as an alternative to conventional care. Dr. Eid writes about food and the brain for Psychology Today, dietdoctor.com, and her website, diagnosisdiet.com, and teaches CME accredited clinician trainings in ketogenic diets for mental health. It is with such great pleasure that I introduce Georgia Eid. Dr. Georgia Eid, will you give us a little bit of introduction of how you got to be a psychiatrist specializing in nutrition? That's a wonderful juxtaposition.
Well, first of all, thanks very much, Cynthia, for inviting me. It's really nice to see you again and to connect with all of your viewers and listeners. So it's a wonderful opportunity to talk about really important topics. So I was a regular psychiatrist for a long time. I was trained conventionally and practiced conventionally for about 10 years, medications and psychotherapy, and I enjoyed it. And however, about 10 years into my practice, I was in my early 40s, I developed some mysterious health problems that perplexed all my doctors and that were really interfering my ability to be productive and happy. And so these included things like, I think that a lot of your maybe perhaps middle-aged female listeners will be able to identify with. So things like migraines and IBS and chronic fatigue and fibromyalgia and and all of my tests came back normal. I had lots and lots of sophisticated testing done and everything seemed normal. So I really didn't want to take a lot of medication. I'm very sensitive to medication and would have had to take 5 or 6 different ones if I were trying to target all these different symptoms. So I just decided, since one of the things I was wrestling with was, stomach pain off and on, I thought, well, okay, let me at least see, maybe food has something to do with my stomach. So maybe I could at least, change my diet, experiment with my diet. And I was eating what everybody thinks we're supposed to eat back then. So I was eating, low fat, low cholesterol, high fiber diet. I was, running and exercising 5-6 times a week. And so in any case, I kept a food and symptom journal and I tried to figure out what was at least hurting my stomach. I thought that was a simple place to start. And long story short, after about 6 months of trial and error with my diet, I ended up with a diet that was very unorthodox, like completely upside down from what we're told to eat. And that was what completely resolved all of my symptoms. So instead of being low in fat, it was high in fat. Instead of being low in animal foods, it was high in animal foods. Instead of being high in fiber, it was low in fiber. And it was just miraculous, literally, how it felt like a miracle that it had resolved all of these strange symptoms. But then the 2 issues, though, one was my mental health improved. And I hadn't even been aware that I had been perhaps a little depressed or anxious or, distractible, et cetera. And I just had never felt so clear and so calm and in my life. And so that got me wondering as a psychiatrist, well, what is it about this diet that must be good for the brain? And the other thing I started to think was, this diet's going to kill me. This diet is meat and fat and cholesterol, and I'm going to die of a heart attack. So I started studying nutrition, really studying it, reading the literature, diving in, trying to get to the bottom of things. And what I eventually figured out was just about everything I thought I knew about nutrition was completely wrong. And so I started using these strategies with my patients. That's sort of how it all began. So I've been practicing this way, incorporating these strategies into my work for more than 10 years now.
Oh, Georgia, how exciting to hear that. And to hear you talking about clearness of mind and calmness and all of these things coming from eating real food in ways that you hadn't been supported in before. So tell me a little more about like your food journal. You kept the food and symptoms, because that may be something that as we go through the rest of the things, people might start to incorporate that.
Sure. So it was really just a notebook. And I put on one side, I put everything I was eating and what time. And then on the other side, I put how I was feeling. So if I had stomach pain, I'd write that down. If I'd had a lousy night of sleep, I'd write that down. If I had a headache, I'd write that down. And I just started experimenting. Like I said, I was trying to target the stomach symptoms. I never thought anything else would get better with food. I literally thought of food for my entire life until that point as simply a way to control my weight. I never, ever thought about the connection between food and mental health, between food and other aspects of physical health, such as pain. I think a lot of people, especially women, may think of food that way. And so as I gradually worked towards foods that didn't seem to hurt my stomach, I was finding that lowering the fiber helped quite a bit. And that the easiest foods that I was noticing were easier to digest and seemed to agree with me best were foods that with animal protein and animal fat in them. So, that's just one piece of the journey, but that was the big kind of aha moment. And so anybody can do this. Any old notebook will do. You can use an app. They have apps now. They didn't have apps back then. You can use an app, or you can use your computer or your phone or whatever you want. But I was just using a notebook, and it's really a simple technique. And I could look back and see, several days in a row when I had headaches, I seemed to be eating these foods. Let me cut those out and see if it helps. That was really that kind of a process.
Very practical and quite utilitarian. Thank you. So what kinds of things, as a nutritional psychiatrist, how is your clinical evaluation process different from a standard psychiatric evaluation?
Yeah, so a standard evaluation, I was taught and to take a psychiatric symptom and mental health symptom history, depression, anxiety, mood patterns over the course of one's life, family history, and some medical history and medication history. But I wasn't taught really to take a nutritional history, and I wasn't taught to do a metabolic evaluation. So, and I think that this is so important. If you've got any clinicians listening, that there's so much science on this now. Really, I think to bring our evaluations into the 21st century, we really need to conduct metabolic evaluations of all of our patients as part of our intake process, because there is such strong evidence now that high blood sugar levels, high insulin levels, poor metabolic health, markers of inflammation, that these things, that inflammation and insulin resistance and prediabetes and diabetes, things you can easily test for, that nutrient deficiencies as well, that you can test for these things. And these are potentially reversible root causes of common mental health conditions. So if you can identify them, then you've got something to sit down with your patient and look at together and get curious about together and start to try to improve together. Before you start talking about medicines, you can start talking about just improving overall health. And if you improve the metabolism of the brain, then the brain will thank you by creating better.
So the kinds of tests that, if our listeners are paying attention here, they could go through what you just described and ask their doctors to look at these kinds of things.
Absolutely. You can ask your mental health clinician for them, or you can ask your primary care clinician for them. You can even, in a lot of places, you can order your own lab test these days if you don't mind not using your insurance, because they can run into some money. But a lot of these tests are very simple, and many of these tests people have already had. Mm-hmm. So, for example, a lipid panel, a fasting lipid panel, which is your basic cholesterol tests, that includes triglycerides and HDL and LDL, that very standard test. most people have had that already. And so that can give you some clues as to, where you stand, where your metabolism stands. If your triglycerides are too high, for example, and your HDL is too low, those are very helpful indicators of metabolism being off kilter.
Mhm. And people can make changes that don't necessarily require medication immediately if they start to do more exercise for the HDL raising and eating less or no sugar for the triglyceride lowering. Are these accurate statements?
Yes, so exercise helps with HDL for sure. And so does switching your metabolism from primarily carbohydrates to primarily fat, whether that's coming from outside the body or inside the body. If you're burning more fat for energy, the HDL will come up. The triglycerides, when you reduce your carbohydrates, triglycerides drop like a stone in most cases. They can drop hundreds of points in just a couple of weeks. So it's really fun for patients to feel empowered to make these changes without any medications. And it's really interesting to see those numbers change. And it's just really eye-opening. So it's a more kind of collaborative and empowering process than I was accustomed to.
That's wonderful. Wonderful. Well, what kinds of eating plans, diets do you use in your clinical work? Could you talk a lot about that?
Yeah, so I do use a lot. I mean, I would say that the ketogenic diet is the cornerstone of my practice, but it's not the only diet that I use in my practice, because not ketogenic diets aren't right for everybody. And there's certainly not a diet that everybody necessarily wants to follow. And it's really important, I think, for people to know that there are other options. So if you don't want to eat a ketogenic diet, or if there are some reasons why you might not be able to eat a ketogenic diet, and so which I help clinicians understand in my training program. But even just a simple paleo type diet, which is it's basically eliminates the grains and legumes and ideally dairy, but that's, some people have issues with that, but at least the grains and legumes, it eliminates all the processed foods and all the added sugars. So it's just a whole foods diet, whole plant and animal foods without the grains and legumes, basically. That diet is so much healthier than the diet most of us eat in so many ways, that diet alone will bring benefits to a lot of people, especially young people, children and teens who shouldn't necessarily follow a ketogenic diet all of the time. So that diet is a wonderful starting place for a lot of my patients, and is often the only thing we need to do, especially in younger people who can deal with the carbohydrates that are in a paleo diet, because the paleo diet contains fruits and starchy vegetables and doesn't put a limit on carbohydrate, but it's all whole foods. And so if you're young or you have a healthy carbohydrate metabolism, paleo diet's fantastic. But for a lot of us, most of us now, especially most of us adults, more than half of us don't process carbohydrate properly anymore. And so we have to be careful how much carbohydrate we take in, even if it's from whole foods.
Wonderful. What low carbohydrate, is that in your eating plans and diets at all?
Yeah, so I use low carbohydrate. So there's kind of simple low carbohydrate diets where all you do is just kind of keep your carbohydrates much lower than usual, maybe 50-ish, somewhere between 50 and 100 grams per day. Especially if you're very active, you could do that and probably get away with it. But and then there are ketogenic diets, which are very low carbohydrate diets, where the carbohydrates come down maybe closer to 20 grams per day, and in some cases even less. And the difference is between those two plans, like a simple lower carbohydrate diet and a ketogenic diet, is that the ketogenic diet, the carbs come down low enough that the insulin comes down low enough for you to start actually burning fat for energy and turning on the ketone production. And the ketone production is very, very good for the brain.
And could you talk some more about that, the brain chemistry and the difference between the high carbohydrate diet and low carbohydrate and keto?
Yeah. So, the brain can run either entirely on glucose, which is how most brains are operating most of the time, if you're eating a high carb diet, or they can run on a mixture of glucose and ketones, glucose from the blood sugar, so it can run on a mixture of glucose and ketones. And so it's kind of like a hybrid engine. There's Professor Stephen Cunnane, who researches ketogenic diets and Alzheimer's disease in Canada. He describes the brain as a hybrid engine. They can switch back and forth and use a mixture of these fuels. And he has shown, and other studies have shown as well, that the brain actually prefers to be running on some ketones. A lot of the brain cells will actually prefer, if they're given a choice, to absorb the ketones and burn those rather than absorb the glucose and burn that. And the reason is that ketones burn more smoothly and efficiently, and they also, you get more energy out of ketones than you do out of glucose, but also it's a lot cleaner. So you don't get a lot of the damage, the high inflammation and oxidative stress that comes with burning glucose. So it's safer for your brain to burn more ketones than glucose. I mean, your brain is still going to need some glucose, but it likes to have a lot of ketones available on a regular basis. So when you're eating a very high carbohydrate diet, the only times you're probably in ketosis might be if you've overnight, when you've sleeping and not eating for, say, at least 8 hours, usually closer to 12 hours, is when you really start to get your ketones starting to rise in your bloodstream to feed the brain.
All right. Well, thank you for that. When you're speaking about glucose, you're not speaking about simple sugar, like the sugar in the sugar bowl, are you?
So the sugar in the sugar bowl is sucrose. Sucrose is roughly half fructose and half glucose. It's like glucose and fructose stuck together. So when you eat sugar out of the sugar bowl, which I hope you're not doing, if you're eating sugar out of the sugar bowl, your system will immediately pull the fructose and glucose molecules apart, and you will absorb them. And so about half of that is glucose. The rest of it is fructose, which goes through the liver and gets turned into glucose. So all roads lead to glucose. So no matter what kind of sugar or starch you're eating, whether it's rice or potatoes or fruit juice or sugar, M&Ms, whatever you're eating, corn, it all turns into glucose ultimately. And that's the sugar, the simple sugar that's traveling through your bloodstream, that some of the cells in the body, including some cells in the brain, and certain areas of certain cells in the brain, do require for your brain to function at its best.
Wonderful. Thank you. And we hear that many young people and children are getting type 2 diabetes and non-alcoholic fatty liver disease early in their lives now. And you just talked about the fructose in the liver. Could you elaborate on that a little more?
Yeah, this is really the thing, that that the diets we think of as children's diets are extremely high in sugar and processed foods. This sort of yogurt that comes in tubes, and colorful cereals that are loaded with chocolate and sugar and frosting, all kind, and fruit juice, and gummy bears, and all kinds of things, and chocolate milk, all kinds of things we think of as kid friendly, peanut butter and jelly, lots of things come to mind. They're just so high in refined sugar that it's constant. It's damaging their metabolism from a very young age. And so, it takes diabetes maybe 10 to 20 years on average to develop. So they're getting a running start, and that's why diabetes is happening younger and younger and younger. And each generation, it happens more quickly because of something called epigenetics, where you pass some of these vulnerabilities down to your children in the womb. And so it can take 2 or 3 generations I think this is one of the reasons why, maybe 50, 75 years ago, people were eating sugar, but we weren't seeing a lot of obesity. But now we are. And it's not just the sugar, but all the processed foods and all the chemicals and all the the environmental toxins and the vegetable oils and all kinds of things that we're eating and exposed to that we weren't even, say, 100 years ago. So yeah, kids, I mean, that's where we have to start. Because once I mean, I'm an adult psychiatrist, I'm not a child psychiatrist. Once I'm meeting with people, a lot of damage has already occurred. And wouldn't it be better if it had never occurred in the first place? I mean, prevention is like gold.
Well, how, with that in mind, how can the adults who are coming to you make the changes in their families' lives to alter what's passed on? How can they do that?
Yeah, it's so challenging because a lot of parents, again, I'm not a child psychiatrist, I'm not even a parent myself, so I'm on thin ice here. But let me just say that a lot of parents feel powerless over what their kids are eating. They feel like, oh, my daughter's going to scream and cry if she doesn't have her, her ice cream. Or I'm going to send her to school and she's just going to eat whatever is there. I won't have any control over that. Well, it's true, you don't have total control over what your child is eating, but you have so much more control than you realize. And especially what you keep in the home, how you eat yourself, how the family eats together, and the types of messages you send to kids about food. And I think a lot of parents, I mean, perfectly well-meaning parents can often use sugar and other types of treats as, to help kids calm down or as a reward. And that's sending a really unhealthy message to your kids that, that sugar and other types of processed foods are for when you're good or when you need to feel better. And that sets up this pattern that gets hardwired in the brain for the rest of your life and then has to be fought with really restrictive diets that may not have been necessary if we hadn't damaged our metabolism and our addictive pathways in the first place.
Wonderful, wonderful. Thank you. So what are the kinds of things that the mental problems that might be improved by changing diet, by changing the food that we're putting into ourselves? If we need to go all the way to a ketogenic diet or somewhere from paleo over, through low carbohydrate.
Yeah, so let's start with the simple. So I kind of think of diets on the spectrum,
Yep.
really horrible
Right.
to really extremely restrictive. So, and everything in between. So let's say if you're eating this kind of the junky modern diet, that's any change you make will be a step in the right direction. So change something. I don't care what it is. So take out some, and really the next step down is what a lot of people think of as a Mediterranean type diet. A Mediterranean diet, if you really look at what it is, I mean, it's kind of vaguely described, but it really is just a diet that's much lower in processed foods. It really, it still has the grains, it still even has flour, it still has even some sugar in it and other types of things are allowed, but it's mostly a more whole foods diet. And that diet is definitely healthier. Lots of studies find this, definitely healthier than your standard diet. So that's a good step in the right direction. But it's often not enough, or at least for my patients, to feel significantly better, because it still has so many things in it that can damage metabolism, interfere with your ability to absorb nutrients from your food, and that can damage the gut. And it's far too high in carbohydrate to be healthy for most of us now who have insulin resistance or damaged carbohydrate metabolism, which is now more than half of us. So this is so junky diet, Mediterranean diet. Right below that, I'd put the paleo diet, which I think makes much more sense as a human diet, because it doesn't have the grains and beans that can be so hard to digest and interfere with our ability to absorb nutrients and damage the gut. So, and really provoke the immune system. Lots of people have difficulty with gluten, for example, or corn or soy. So it's a lovely step in the right. And then below that, we have lower carbohydrate versions of the paleo with, a lot less fruit and root vegetable, for example, would be a very healthy, low carbohydrate, whole foods diet. And then you can even go further than that and do elimination diets, and you can even do a carnivore diet, which is a plant-free diet. That's something else I sometimes use in my practice. But in any case, this spectrum, any step you make in this direction towards paleo, if you're at the standard diet now, would be good for you. Very healthy. Anybody can do that. Doesn't matter if you're taking medications, doesn't matter how old you are or young you are. It doesn't matter what your health issues are. Paleo is safe for everybody. You don't need any specialists involved if you do that. You'll be getting all your nutrients. It's perfectly healthy. But if you're moving to a low carbohydrate diet, that's where you can get so many more benefits for the brain, because you're turning on those ketones, which are so healing for the brain and protective for the brain and energizing for the brain. If that's a lovely place to go. But in some cases, depending on the medicines you're taking or the health issues you may have or how old you are, you may need medical supervision for that, at least in the beginning. So I just want people listening to know that they shouldn't just jump onto that diet, that they should learn more about it before they take that step. But it's an incredibly powerfully therapeutic intervention. And when people shift into ketosis, they can feel the difference. It's like night and day in terms of how the brain and body feel.
What kinds of specific changes, like with SNRIs and SSRIs, all of those, are those places where a doctor needs to be involved with this change in eating plan? And if so, why?
So with the very simple psychiatric medicines, I talk a lot about this in my training program, because there are a lot of psychiatric medicines out there, and some of them are easier to work with than others on a ketogenic diet. So with the simpler medications like SSRIs and SNRIs, things like Prozac and Effexor and Zoloft, Cymbalta, those medicines, there really isn't anything special you need to do with those medicines if you're starting a ketogenic diet. However, as you're adapting to the diet and adjusting to the diet, those medicines may feel less comfortable than they had before, and you might need to lower the dose a little bit. But that's something that you should work with your prescriber around, so that you don't just stop the medication. Never, never, never stop a psychiatric medicine abruptly. You will regret it. It is. In some cases, it's just extremely uncomfortable in physical and mental ways, emotional ways, but in some cases, it's actually dangerous. So seizures, for example, are a potential side effect of stopping certain psychiatric medicines abruptly. So if you're looking at medication changes, you must consult with your prescriber. So I always tell people, talk with your prescriber and everybody on your healthcare team before you start a ketogenic diet, not after, so that you can work together and monitor things together as you progress.
Would this be true with low carb diets and eating plans as well, or just to a lesser degree?
That's a great question. It depends on how low you're going, because so taking all the junk food out, that's going to be fine. Going to paleo, that's going to be fine. But once you start to get down below 100 grams of carbohydrate per day, depending on your metabolism, you might start to shift into ketosis. And everyone's got a different threshold. Most people will shift into ketosis at 20 grams per day or less. But some people who are metabolically healthier or much more physically active may shift into ketosis at higher amounts of carbohydrate. And when you shift into ketosis, this is the power and wonder of a ketogenic diet, but it's also the risk you take if you're taking certain medicines or have certain health problems. When you shift into ketosis, your blood sugar drops, your insulin levels drop, your blood pressure can drop, all healthy things. You want your blood sugar to come down. You want your insulin levels to come down. You want your blood pressure to normalize. But it can happen so quickly that if you're taking a medicine for one of those conditions, you can suddenly find yourself in big trouble. because now you've got this diet that's lowering your blood sugar or blood pressure or insulin levels, and you've got this medicine that's doing the same thing. And now it's just far too low and far too fast. So that's how you know the diet is effective. It helps you lower your glucose and insulin and blood sugar levels, and in some cases blood pressure levels too, and it helps you lose excess fluid, which we all want, right? You want to carry around that water weight. But when that happens, it can really affect you if you have heart disease or high blood pressure, you're taking medicines for these things, or diabetes. So we talk a lot about this in the course, is how do you navigate that transition safely? Because you want these things to happen, but you need to have the medicines adjusted carefully. And if you've got a lot of health issues or you're older, you may need to very gradually transition to a ketogenic diet rather than all at once.
Okay, thank you. What are the benefits for people who have anxiety? And I'll list a whole bunch, and then whichever ones you want to talk about: depression, anxiety, Alzheimer's, ADHD, fibromyalgia, chronic fatigue, all of this range of items, that some of which you mentioned earlier. How are those affected by these changes in eating?
Food affects our bodies and minds so much more than I ever realized. So every single one of those things, you can use food to try to improve, and most of those things will improve if you eat a healthier diet. And the question is, how much healthier do you need to get, right? So because for some of us, we just need to make small changes, and others of us need to make major changes. That it's not fair, but that's life. This is the truth. And so, so let's say, for example, let's talk about the physical issues first, and then we'll talk about the psychiatric issues. So the physical issues, let's say, for example, chronic pain or chronic fatigue, things like headaches and fatigue. A lot of that has to do with inflammation. So inflammation is one of those things that can cause just about any type of emotional or physical issue. It's one of those root causes of chronic illness, whether it's chronic mental illness or chronic physical illness. So when you look at just about any condition in the book, you'll find inflammation as part of that. So how can you reduce inflammation with your diet? Well, you can stop eating anything that makes you feel bad. That's the first thing. So if something hurts your stomach, or something gives you a headache, or anything like that, or makes you feel achy or tired, and you're noticing that, a lot of people do, they might notice that, but may not realize how important it is to really avoid any food that's making you feel worse, because that's inflammation that you're sensing. And so cutting down on foods that cause inflammation. For some people, that might be dairy. For some people, it's sugar. And sugar, we know, causes high blood sugar levels, which you're getting if you're eating anything that spikes your blood sugar, even if the blood sugar comes right back down to normal pretty quickly. Anything that spikes your blood sugar is going to give you a spike of inflammation in your body as well as in your brain. So get the sugar out. The vegetable oils, all the vegetable oils, things like, soybean oil and all of those industrially processed, they're extremely inflammatory. Take all of those out of your diet. The sugars and the vegetable oils, and anything that rapidly turns into sugar, like juice and syrups and crystals, liquids, anything liquid, crystal, or sweet, get all of that out of your diet. That's all promoting inflammation. Just doing those two things, the sugars and the vegetable oils, can make a huge difference. And remember that flour is sugar. Powdered starches are sugar. Rice is sugar. So, any of that refined stuff, cereals, all that stuff. So even if you're not doing a ketogenic diet, just cleaning up your diet so that you have less inflammation. Depression is really strongly connected to inflammation. We know that inflammation can cause depression. And some people with inflammation, they don't respond very well to the standard antidepressants, because the antidepressants aren't really addressing the root cause, which is inflammation. So so anything that hurts your stomach or gives you a headache or makes you tired or makes you achy, get that out. So that's step number one. If you're trying to address a number of mental health issues and cleaning up your diet around the edges isn't enough, then regardless of the issue, the exception being anorexia, if you're underweight or have a history of being afraid to eat fat, or if you are afraid to gain weight, if you have a kind of complicated relationship with food, ketogenic diet's not right for you, would not be healthy for you. But for everybody else, if you have normal weight or higher, and you have not ever wondered if you had anorexia, or been told you have anorexia, or been told you're underweight, you can use a ketogenic diet to try to address any other psychiatric issue, from minor to major. So minor meaning, I've brain fog sometimes, or I don't get enough done, or I don't always feel my best, or, not feeling social as I should, or just, not having enough oomph, really minor issues, to major, major mental illnesses, psychotic symptoms, bipolar mood patterns, severe depression with suicidal thinking, and everything in between, ADHD, generalized anxiety, major depression, PTSD. So anything other than anorexia, you can use a ketogenic diet to try to help. There's papers coming out all the time now, not only just in the scientific literature, not just about mechanisms like, how the ketogenic diet can help you, regardless of which issue you have, but there are also some lovely case reports, really compelling case reports published of people making tremendous strides with their mental health, and being able to come down on their medications, and sometimes being able to come completely off their medications by using a ketogenic diet. So it really, because the ketogenic diet improves the health of the brain in multiple ways, because the brain is designed to spend some time in ketosis on a regular basis, you can potentially address, it has the potential to address just about any psychiatric problem. And there are now studies underway in bipolar disorder, bipolar illness and psychotic illness at Stanford University. Dr. Shivani Sethi-Dalai is heading up those studies. We're really excited to see what her studies find. There are studies being conducted of bipolar illness that are getting underway in Finland, as well as in Scotland, and studies of ketogenic diets in anxiety in Mexico, and there are more studies being approved all the time. So we're going to have some really wonderful data pretty soon. But I would just say that we have 100 years of science now telling us that ketogenic diets are good for the brain, various other types of brain conditions. So why should psychiatric conditions be any different? Ketogenic diets improve the health of the brain, which is exactly what you want if your brain isn't operating up to snuff.
Sounds fabulous. So what have you found with your experience with people who have sugar addiction, food addiction? They've self-identified that they have problems with food, and they haven't been able to adjust their food significantly.
Yeah, if you have people with food addiction or sugar addiction, if you've never tried a low carbohydrate diet, it is really so worth trying, even as an experiment, to see if it feels different for you. And I would be willing to bet that it will feel very different to you in most cases. And there's actually had pulled these out in preparation for our talk. So these are two papers on this topic, which are lovely and recent. So and they both come. I'd mentioned Dr. Shivani Sethi-Dalai at Stanford. This is a topic of interest for her. And these papers are looking at binge eating and food addiction, the science of it, the chemistry of it, and the potential for low carbohydrate diets to be helpful. And this paper in particular is three case reports with people with binge eating and food addiction who were able to essentially completely resolve their very frequent binge eating and to lose some weight, significant amounts of weight, by eating a simple low carbohydrate diet that limits carbohydrates to about 30 grams per day. This is a 6-month. These are 6-month cases where people were able to stay on the diet and experience significant relief from their cravings. They were able to lose weight, and they were able to bring their binge eating episodes down to virtually 0 episodes per week.
Wow.
It's really amazing. And I see this in my practice all the time. So I had a woman I was just working with just a couple of weeks ago, who has allowed me to share her story anonymously, and she's, sent me some quotes and things, but she has been trying to get her binge eating under control for many years. And so it had been historically kind of difficult for her to shift onto a low carbohydrate diet because the cravings are so strong. So one of the things we noticed together, and she also had lots of symptoms of depression and anxiety, met full criteria on diagnostic questionnaires, including the Beck Depression Inventory, for major depression and for generalized anxiety disorder, as well as 11 out of 11 on a modified Yale food addiction scale, like off the charts food addiction symptoms. So she, one of the things we noticed as I was trying to help her was that dairy could not be part of her plan. So she was following a low carb diet that included up to 4 ounces of cheese per day, which some ketogenic diets, some really popular low carbohydrate diet plans will allow for. And that's fine if you don't feel addicted to dairy, but the dairy was the trigger for her. We had to take the 4 ounces of cheese out of the diet. And that was, then she was able to get beyond day 3 without binging. And so what we did was we did a ketogenic diet. We actually, this last go around, we did a carnivore diet where she just ate as much meat as she wanted, of whatever type, for a week, just to help her shift. And then she expanded it and added vegetables and things. But within 4 days, she was in ketosis, her cravings were gone, and she was feeling like a new person. And she said things to me like, when I'm eating all that carbohydrate, I don't have a life. My life isn't worth living. And when she, 4 days later, when you see the ketones show up, she said, everything I filled out in your questionnaire is exactly the opposite. It gives me my life back. This gives me my life back. And so you see this in patients all the time. And I think more people, I've worked with so many patients who have done other plans, Overeaters Anonymous plans and gray sheeting and all kinds of other types of, food addiction plans. For some people, getting into ketosis is the thing that works best for them, and gives them a fighting chance, because it really changes the chemistry of appetite.
So for those people that the paleo or the low carb eating takes away their cravings, they can deal with that. But for those who still have cravings, even with low carb or paleo, those are the people that need to move further into the keto and ketosis to get the freedom from cravings. Is that accurate? Yeah.
I wouldn't promise everybody that will work for everybody, because nothing works for everybody, but this is what works best in my practice for most people.
Okay. And for those people who have cravings, they identify as mental cravings, not physical cravings. How does that work? How do they get relief?
Yeah. So do you mean, can you be a little bit clearer or explain a little bit more about what you mean by the difference?
The person is free from grains, sugar, and has eliminated a number of different foods and still has what she defines as mental cravings, not physical. She says they're not the sort of cravings that she had when she was eating grains and sugar and so on. They're not that kind. There's something else. They're a desire to eat, a longing to eat, a desire to have that satisfaction you mentioned earlier, that young children will get this idea that if you're good, you get sugar and sweets. If you're sad, you get sugar and sweets. If you are anxious, you get sugar and sweets. So it's that kind of, if I'm feeling these feelings in my emotions, then I need to have this, I need satisfaction of some sort. How do I get that?
So there are so many questions wrapped up in that. So one question, if I were speaking with this person,
Yes.
I would ask her, has she ever done not just taken out the sugar and grains, but has she ever tried a ketogenic diet before? And if she hasn't, it's worth it because it can, in some cases, turn off what feel like psychological cravings, and because the control of appetite involves more than 24 signaling molecules, and a lot of those molecules are in the brain. And so if the brain isn't getting if the brain metabolism isn't optimal, which a ketogenic diet will help with, then you could still have imbalances in those appetite chemicals. And it can feel for all the world like has to do with your childhood, or it can feel like that. And in a lot of cases, it's really just chemical. Now, that does not mean that this works for everybody. And the reason why, most people will get at least some relief from a ketogenic diet, and many people will get complete relief on a ketogenic diet, but you still have to deal with all of the environmental cues, triggers for overeating, which for those of us with food addiction, and I include myself among those people, I really think of it as a lifelong vulnerability. No matter what you're eating or how much progress you've made, it's always just one bite away from, it's really an addiction. And so, smelling something or seeing something, having somebody mention cake or, pudding or ice cream or whatever your thing is, that can be all it takes for some of us, even if we're doing everything we can with our diet and our exercise and our behavioral strategies and our relapse prevention strategies. So it's really important to make sure you know what those things are and try to avoid them as much as you can, and have support, and make sure that you're basically working your plan every day to increase the friction, that make it more difficult for you to come across those cues if you can.
Those are wise things. Could you help us understand the neurotransmitters in terms of dopamine is frequently talked about, serotonin, others? What, we have these brains that are pharmaceutical. So could you help say a few words about that?
Yeah, so the people who study addiction, they talk a lot about dopamine, and because dopamine is it's a chemical, it's a brain communication chemical that is involved in lots of different things. But one of the circuits it's really central to is our reward circuit. So people talk about getting a dopamine hit when they're doing something like cocaine or bungee jumping or whatever, what have you, and processed foods and high sugar foods seem to stimulate that same pathway. And so it's really important to try to avoid the types of foods that give you that hit. And people know, when you talk to them, they know what I'm talking about. It's not just hunger. You're looking for a feeling, a particular type of feeling that comes from that dopamine surge. And it's not as simple as dopamine. There are lots of other chemicals involved, but that's the one that is the most important to be thinking about. So, we were designed to eat whole foods. We weren't designed to pour sugar and oil and combinations of sugar and oil into our systems, and add some salt to that too, and all kinds of spices and intense flavors, and make it just impossible to resist. That kind of stuff doesn't exist in nature, So I think that we can really, when you overstimulate your dopamine system with unnatural foods that were not designed to handle, what can happen, and this is the really sad thing, what can happen is the brain can kind of start seeking those things. because it was like, wow, that was amazing. Let's do that again. And that doesn't happen with whole foods. It just doesn't. So it's really important to protect your dopamine signaling system by not overstimulating it with all of these intensely what are called hyperpalatable foods, high sugar foods, and foods that have just that magical combination of sugar, fat, and salt that doesn't exist in nature.
Well, when people are talking about that and they don't say the additional word, the grains, but so many of the foods that they talk about are the foods that do include grains. I don't understand that. Could you parse that out a bit?
Yeah, so grains are so interesting. So there's whole grains and there's refined grains, and they have very different effects on them. And none of them are healthy for us. Let me just say that right off the bat. These are not human foods. I could talk about that for an hour, but I would digress. But let me just say, if you want to know more, you can go to my website and you can Diagnosis Diet. You can learn all about grains and why you need to fear them. But in any case, there are whole grains and there are refined grains. So a whole grain is going to be a lot safer for your blood sugar because it's going to take your body a lot more time to digest it. It's got a hard shell around, a fibrous shell. The carbohydrates are inside. It takes a long time to dig through that, and it takes a long time for them to turn into blood sugar in your body, right? So you're not going to get a big, huge spike. But if you refine that grain to any extent, like let's say you polish it so it makes it easier to chew through the fiber. Let's say that you grind it up. Let's say you coarsely grind it like cracked wheat, or what's the other word they always use for partially refined grains? I don't know.
Steel ground to oats, for example.
Yeah, steel ground, all that kind, exactly, steel ground. So that sort of a thing. It makes it a little bit easier. If you break it into pieces, makes it a little bit easier to get at the sugar, right? So that's a little bit more for your blood sugar. But let's say you grind it, pulverize it into a powder. Now you're in trouble because now what you've got is sugar. You don't have, a whole grain anymore. You've got sugar. That flour is sugar. And so that's going to give you a big insulin spike, a big blood sugar spike, and it's going to be just as addictive as sugar is. The body's not really going to be able to tell the difference. In fact, I'd argue that it's even worse than sugar because of all the other things that grains have in them, which are not good for our guts or good for our immune systems or good for our nutrition. So, so if you're going to eat grains, eat them whole. Don't put any sugar on them. And if you enjoy that kind of a thing, great. I can't think of anything particularly delicious that is, would fit into that category, but enjoy. But if you're dealing with, especially with the powdered grains, you're really just eating sugar, and there's nothing healthy, absolutely nothing healthy, no health benefits to refined flours. And I just want to say one more thing about this, which is that all the studies, I can hear people in your audience saying, but I thought whole grains were healthy for me, right? So where does that information come from? All the studies, every single one that has tested whole grains and found them healthier has compared whole grains to, guess what? Refined grains. So whole grains, yes, they are healthier than refined grains, but are whole grains healthier than no grains? No. So keep that in mind. If you're going to eat them whole, but I'd really rather, because I care about your brain and your health and your gut and your immune system and your nutritional status, I prefer you didn't eat them at all.
Georgia, thank you. What, with regard to all of those diseases, like Alzheimer's and dementia are so much a concern as our population is getting older. And so how does all of this information play into that? I've heard Alzheimer's being called the type 3 diabetes.
Yeah, I'm really glad you asked that. That's such a fantastic question. It's such an important topic. So, because we're told all the time, right, that there isn't anything we can do about Alzheimer's. We're told that, oh, it's about our genes or our family history or our age. We can't do anything about any of, any of those things. So, we kind of feel like sitting ducks. We sort of look at, maybe an aging parent or a grandparent who has had to deal with Alzheimer's and thought, okay, well, here I go, this is my destiny. But there's so much information that hasn't made it into mainstream conversation, so much fabulous, really powerful science about Alzheimer's disease and nutrition, which is very empowering and extremely hopeful. And this is it, which is that insulin resistance, which is just means, kind of damaged carbohydrate metabolism, your blood sugar is running a little too high. Sometimes your insulin levels are running high, too often. You're basically eating too much high sugar food too often. You're eating the wrong types of carbohydrates too often. So it's throwing everything off balance. That's going to lead to insulin resistance and eventually often type 2 diabetes and eventually often dementia. And so that really, if you are trying to reduce your risk of Alzheimer's disease, what you need to know is that insulin resistance is a causal factor of many cases, most cases, likely of your sort of garden variety Alzheimer's disease, or what is called late onset Alzheimer's disease. The science is crystal clear on this, because the problem with Alzheimer's fundamentally is an energy crisis. The brain doesn't have enough energy, and so it's dying. And so the reason why that's happening is that if you've been eating the wrong carbohydrates, too many of them too often, and damaging your insulin signaling system and getting high blood sugar spikes too often, what's happening is on the surface of the brain, the blood-brain barrier, which is these delicate blood vessels and the special barrier that protects the brain, the insulin receptors on the surface of the brain become insulin resistant. What that means is that you've been bombarding them with too much insulin 3, 4, 5, 6 times a day for 20, 30, 40, 50 years. So they become dull and they don't work as well. And they become fewer in number. So it gets harder and harder for insulin to cross into the brain as you get older, if you eat that way. Glucose has no problem going in. Don't worry that your brain is going to be, starved for glucose. That's not a thing. So glucose goes in, no questions asked, no matter how old you are, no matter if you have severe insulin resistance or even type 2 diabetes, glucose is waltzing in. In fact, sometimes too much is waltzing in. It's the insulin that has a harder and harder time crossing in. And that's a huge problem because the brain cannot use glucose without insulin. Your brain cells can't turn glucose into energy without insulin. So if you've got high glucose in the brain and low insulin in the brain, your brain is going to be swimming in a sea of glucose and still be starving to death. The only way to correct this problem that we know of is ketones, which can bridge that energy gap and bring some of those cells that might be sputtering, the ones that haven't died yet, the ones that are sputtering and looking for energy and not getting enough, they need ketones and they can be revived by ketones. And just about everybody who goes on a ketogenic diet, whether they're young or old, says, oh, I'm much more mental clarity. It's amazing. So there's so much hope there. And it's never too early to turn this around because Alzheimer's disease doesn't start in your 60s, 70s, or 80s. It starts decades before. Mm-hmm. Decades before, you can see this glucose processing slowing down in the brain, even in young people in their 20s. The glucose processing is starting to fail because you're overusing the system and damaging it. So start right now, no matter how old you are, to fix that problem.
What a helpful discussion that has been. Thank you. With regard to this aging process, what are some of the things, including menopause for women and menopause for men, what are the things that low carb eating plans, paleo, low carb, and keto can actually help with?
I love this question, partly because I'm 57. So
you look fabulous.
I don't know how much longer that's going to last. it's a humbling experience. Aging is a humbling experience. Let me just say that menopause is a humbling experience. And I feel like I'm, sailing through it for the most part because of my diet compared to other people in my family. So it's been really relatively easy, but it's still one of those things where you realize you don't have control over everything. That, even the healthiest of diets is not going to completely protect you when it comes to the loss of estrogen that happens, and growth hormone to a certain extent that happens as you age, women out there. So, this is where hormone replacement may be very well worth considering with your practitioner. It's turned out that it's a lot safer than we used to think. And so in a lot of cases, it's going to be healthier for you to replace your hormones than to let them go. So that is something that I've just become interested in personally recently. So in any case, even the best diet, a ketogenic diet, is not going to help with the estrogen decline. It's going to happen no matter what you do, but it may be a safer and more comfortable and healthier decline than otherwise. And the reason why is because when you're eating all that junk, all that this high sugar diet, it really throws a monkey wrench into your delicate hormonal harmony that's supposed to be occurring. I mean, the body is designed to have this beautiful balance, this beautiful kind of orchestration and interaction between all of your hormones. And hormones are supposed to be things that are released in tiny amounts at just the right times. It's all very, very beautifully orchestrated and very carefully regulated. When you throw sugar into that equation, you really have a mess on your hands. What's happening is every time you get a blood sugar spike, you're getting an insulin spike because the insulin's got to pull that blood sugar back down to normal or you're going to be in trouble. So, but insulin isn't just a blood sugar regulator, it's a master growth hormone. And what that means is it is like a conductor, and it's telling all of the other hormones, most of the other hormones in the body, what to do, how high they should be, how low they should be, whether they should be turned on or turned off, and how much. So when your insulin levels are doing this all day long, which is not supposed to be happening, if this is happening 6 times a day, think about all the other hormones in your system which are getting dragged along for the ride. These include your reproductive hormones. These include your hormones that regulate blood pressure, your hormones that regulate appetite, your hormones that are your stress hormones, your adrenals, your cortisol and adrenaline levels. All of these things are being dysregulated. So if you want healthy hormonal balance and the least amount of, roller coastering that I mean, a lot of women benefit from a low carbohydrate diet because their hormones quiet down. You don't get these huge swings that cause all kinds of, moodiness and irregularity and so forth. So if you eat properly, and even just eating a paleo diet can do this, your hormones will really thank you for it. So the closer you can get to a diet that makes sense for the human body, everything's going to work better.
Well, thank you. A quick one about COVID. What has COVID done to the mental health and food and relational situation?
Oh boy, what a mess. So it's been really tough. We are social creatures. We need air, we need light, we need people, we need interaction, we need, stimulating experiences, often that are really social, like singing in a chorus or playing a sport, dancing with other people, even just, taking a walk with other people or gathering at someone's home for a meal, watching a movie together. Like these things really feed us. I don't even think I realized how important all these things were until they were taken away. And so it's really tough on mental health. So many of my patients who are already, struggling, even when times were better, when COVID came along, it really hit them hard. So this is such an important piece of the puzzle. And to make matters worse, a lot of people, cooped up in their houses and not able to, do the things they love, they might turn to food, junk food, for comfort, for recreation, to kill time, or just to get a little bit of enjoyment. And so that's led to, of course, lots of people, their health has declined, their physical health has declined during COVID. And of course, the body's part of the brain. Lots of studies have concluded this. The brain is part of the body, that the brain suffers as well from that eating pattern. So a lot of people got more depressed, more anxious with COVID. So it's the tough thing is that probably the best thing you can do for yourself to deal with not just the mood issues that can come along with the isolation, but also with the viral infection itself, to protect yourself, to give yourself a fighting chance against COVID if it gets into your body, is by eating a healthy diet. Because if you're eating a lot of sugar, you're damaging your immune system. And this has been shown in beautiful, elegant studies that people with respiratory infections, including COVID, if your blood sugar and insulin levels are too high, your immune system is going to be sluggish and it's going to respond. It's not going to have your back. It's going to take you at least a week longer to start fighting off that virus than if you were eating a healthy diet. I wrote an article about this for Psychology Today. I can't remember the title of it, but if you typed in Psychology Today, my last name is Ede, so you type in Psychology Today EDE COVID diet, it'll come up. I wish I could remember the title. It explains exactly the connection between diet and the immune system in a really short article, and it gives you simple ideas. And you don't have to do low carb necessarily to get the benefit. It gives other ideas as well. So, and it's about 1,000 words long. It's very short.
Thank you very much. What about, you mentioned binge eating disorder and food addiction. How are those, if you would send me the references that you've mentioned during the course of this conversation, we'll post them. But also, how are those two separated or overlapping? Because the binge eating disorder and the food addiction, how are we teasing those apart in terms of potentially putting food addiction as a substance use disorder in the DSM, we hope. And but we need to separate out food addiction from these other things. And sometimes they seem to be intertwined or overlapping, or what to do.
Yeah, so it's well, first of all, these diagnoses aren't necessarily always particularly helpful, because in the real world, our brain isn't divided into these, this is the depression area and this is the binge eating, and this is the, the brain isn't divided up like that. It's all one organ, and it's all, people who binge, many of them have food addiction. People who don't binge, there are many people who don't binge who have food addiction. And so, but many people, it overlaps in a great number of people, because if you have food addiction, it's hard not to binge. So there is that. And so I think that this is more of an academic question about, okay, where's that line between binging and food addiction? Food addicts know who they are. Binge eaters know who they are. Many people would identify as both, but I certainly know people, many people, patients, as well as in my personal life, who are food addicts but do not binge. And so they just I'll give you an example. A friend of mine who can't go more than 2 or 3 hours without eating bread or sugar, and this person does not binge on those things, but must have them on a very frequent basis, or they feel absolutely, they can't stop thinking about it. They can obsessed with it. We have to stop whatever we're doing, and we have to go find one of these items for this person to eat, or they get grumpy and anxious and start to feel absolutely miserable. So, and you can see the look that comes over their face when they have something. Usually bread is the thing that they're looking for. You can see the look that comes over the face when the bread enters the system. It's like, this person is clearly addicted to these foods, but does not binge. Mm-hmm. Just eats frequently and eats the wrong things, and eats in a pretty unhealthy way, and never feels good. And it feels really trapped, really attached in an unhealthy way to these foods, and it's hard to get through the day. without having those available 24/7. So that's kind of how I see it in the real world. But the good news is that fixing your diet to whatever degree you need to will, is going to help both of these groups of people. So because if you don't, if you're regulating the appetite, the hormones that control appetite, some of them, these are in your gut, some of these are in your brain, and of course they're all talking to each other. If you eat in a way that quiets those things down, you won't have to work so hard to fight in this world of tons and tons of food triggers. You're going to have a little bit of a coat of armor around you. It's not going to be perfect, but it's going to be so much easier. So I have patients who, they can't go into a grocery store when they're eating the wrong way, because no matter what they've got on the list, or no matter what their motivation is, no matter how many tools they have in their toolkit, they're coming out of that store with something they didn't plan to come out with. When they're eating the right way, they've got a fighting chance of getting out of that store with only the things that they intended to go in and buy. So so many people have described these night and day experiences to me. It's like a different frame of mind, and you can't get there by brute force.
Right.
The brain chemistry, if the brain chemistry is not with you, it's against you. So it really, again, for those who haven't tried it, it's such a powerful intervention, and the chances are so good that it will be helpful to you.
Well, are there any people that should definitely not use ketogenic diets? I've heard you mention a couple of groups that we want to put that information out there. And then any closing comments that you have. This has been so wonderful.
Oh, I've enjoyed every minute of it. You're asking such important questions, and I hope it's reaching people that will find it helpful. So people who should not do a ketogenic diet. So people with anorexia, we talked about, people who are underweight, people who are afraid of eating fat, people who are afraid to if they're underweight, to gain weight. All those people, ketogenic diet's not the right diet for you. So we'll just say that right up front. But if you are currently pregnant, you should not start a ketogenic diet during pregnancy. If you are breastfeeding, you need to learn more about the pros and cons, because there have been case reports of people eating very strict ketogenic diets, too strict for breastfeeding, and that have run into problems. So I can't recommend it for people who are breastfeeding. And there are certain metabolic conditions which are usually diagnosed in childhood, which we won't talk about right now. It's too complicated to go into, but these are metabolic problems with burning fat for energy. You usually get these diagnosed when you're an infant. And then anybody who is taking any kind of prescription medication or has any kind of a health problem at all, or if you're older, let's say you're over 65, or if you're under 18, you need to learn a lot more about ketogenic diets before you even think about starting one. So I really recommend that people consult with somebody before they start this diet, to make sure that they're not in one of these riskier categories where their blood sugar might drop too fast, or their blood pressure might drop too fast, or their medications might need to be changed. And the whole reason that I created this training program for fellow clinicians, well, two reasons. One is that there are lots of people looking for this kind of help, and very, very few people who feel they have the knowledge or the confidence or the experience to help people using these diets for mental health conditions. That's one reason. But the other reason is that it can be a little tricky navigating the medications and the adjustment period, the first several weeks of the diet. If you have a mental health condition, you can, in some cases, start to feel worse before you feel better. And you really want somebody on your team who knows how to help you through that. So a lot of caveats there, but that's not because the diet is unhealthy. It's because the medications or the health condition that you have is going to make it really important that you have professional guidance as you're shifting to this much healthier diet.
Thank you. Could you say a few words about your available, the accreditation, CME accredited program?
Oh yes, thanks for asking that. So yeah, so the program is, so what it is, it's an online program, small groups, 6 people, 6 clinics, limited to 6 clinicians per class. It's a 5-week class, 90 minutes per class, got about 100 pages of supplementary materials, resources for your practice, all kinds of reference materials, and all the material that's covered in the class. In any case, that course is CME accredited by the AAFP, and that means that it's not just for physicians, but also for physician assistants, nurses, nurse practitioners, and not just MDs, but DOs. And so lots of wonderful inclusions come with the AAFP accreditation, and it's also approved by the ANA, the American Nutrition Association, for certified nutrition specialists now. So lots of credits available, and it's such a wonderful, I mean, the thing I love about this course is meeting people of all different backgrounds, professional backgrounds from all around the world, who are excited and passionate about these treatments, and often very knowledgeable. And we all learn from each other and share with each other, and we stay connected going forward. And so I love it. But in any case, that course, we've got, I don't know when this interview will air, but we have some openings for the classes that begin October 26th. It's going to Tuesday afternoons and evenings. There are openings in those classes. So if anybody's interested, it's on all my website, Diagnosis Diet, and there's a trainings tab if you're curious, or you can, contact me through the website on the trainings page if you have questions about it, if you're not sure. You just, I'm happy to answer questions or put you in touch with other people who've taken the class if you'd like to know what it's like.
So diagnosisdiet.com. Wonderful. Oh, Dr. E, what a pleasure to be with you. I could continue listening for about another 3 or 5 hours. Thank you so much for your time and your knowledge, your experience, and putting us into a much different mindset in terms of the melding between the physical body and our heads that include our brains and our guts. Oh, what a pleasure to hear that all connected. And you really do that. So thank you. Any last words?
Well, I just want to thank you, and thank you for all of your important work and focusing on this topic, which is this, the topic of food addiction. It's so central to health, because people with food addiction will end up very often with serious health problems as a result of the pattern of eating. And I know that was true for myself as well, why I had to turn things around for myself. So you're doing really important work, and I really thank you for calling attention to it and for inviting me to be able to talk about these things. And it's always just so great just to see you, Cindy. So
thank you. Thank you so much, Dr. E. What a pleasure. Thank you.
Thank you.